let's see. Yeah, okay. Why don't we go ahead and let people in? You ready? Everybody ready?
Mhm.
Okay.
And we're also on YouTube again if anybody's having trouble with Zoom.
Okay. Thank you. Good morning, everyone. Thank you all for joining us. And thank you for being prompt. So we will give those of us who need a little extra minute, a few minutes to get in, and then we will get going. So thanks for being with us.
I said that to you in case you needed to send it out.
Thank you. Good morning, everyone. To those of you who've just joined us, we thank you for being here, and we're going to give everybody a few more minutes. We got some more people coming in, so we'll give it just a few minutes, and then we'll get going. Good morning, everybody. We'll give it just a couple of minutes. I appreciate all you prompt people, but we'll give those of us who need to be on time just a couple of minutes, and we will get started. So thank you. Good morning, everyone. We had a couple more people join us and we've got a couple of people coming in, so we'll give it just another couple of minutes. All right. Well, we were going to get started this morning. So I'm Kim Becker. I'm the social media and marketing coordinator for PATH, People Against Trafficking Humans Coalition of Kentucky. So thank you all for being here. We appreciate you spending this time with us. January is National Human Trafficking Awareness Month, if you did not know that. And so PATH has offered over the last every Thursday in January a different session about human trafficking and the items around that, such as trauma-informed parenting, caregiving. So I'm going to tell you just a little bit about PATH. We are a nonprofit 501c3 organization actively working to combat human trafficking occurring in Kentucky. Our mission is educating, informing, and empowering ourselves and others in understanding human trafficking and promoting and advocating social justice efforts toward its end. And thanks to the generosity of the Sisters of Charity of Nazareth, we were able to provide these sessions at minimal cost. And so I know I see some names who've been on here with us for multiple sessions, so we appreciate you being with us throughout the month. And we are very excited for this wrap-up session on trauma-informed parenting/caregiving. So I'm going to tell you that if you have questions during this session, please put them in the chat. We'll be monitoring that and we'll address them when we can, but we'll definitely get to them at the end. And I am now proud to introduce Dr. Kaylee Archie. Dr. Archie is a licensed independent clinical social worker and has dedicated herself to the transformative field of social work. She received a bachelor's and master's degree in social work and went on to pursue her doctorate in social work from the University of Kentucky with an emphasis in clinical practice. Currently, she is an assistant professor in the social work department at Marshall University. She is passionate about empowering others to drive change within themselves and their communities so we can change the world. So, Dr. Archie, I will turn it over to you.
All right, thank you all. Thank you, Kim, and it's really exciting to be here and be able to share with you all. Today we're talking about trauma-informed parenting and caregiving. I know we have some social workers here. I think we have some nursing students, some foster care family caretakers, maybe people in education. And so really, if you're working with individuals or children in any capacity, having an understanding of trauma-informed caregiving is important. Whether you're in the role of the caregiver or, you're a social worker, nurse, teacher, caretaker that is guiding or helping someone else navigate this role, and you're serving children just in any way, it's important that you kind of have this background of the effects of it on our children and on the role the toll and role it takes when you're in this position of caregiving. And so we're going to kind of go through the impact that it has on children and caregivers. We're going to talk about some of the developmental, physical, emotional impact that trauma has. Then we're going to go over a coping skill that I always like, anytime I do a session or lecture or anything like that, I always like to give you something that you can leave with, that, you know, you've learned that you can apply to your life, or you can help other people tangibly, you know, apply to their lives. And so I'll teach you a little skill. We'll go over that you can help, kind of a coping skill that can be beneficial. And then we'll talk about compassion fatigue and burnout a little bit, and what that can kind of look like. Because when you're in any kind of helping professional field, if you're a parent or caregiver of children that have a past history of trauma, it's important that you know, take care of yourself and can prevent the best you can some burnout and compassion fatigue. So the first thing we're going to look at is the impact that trauma can have on children and caregivers overall. And so, let's see. It's, you know, it's not a secret that trauma has an impact on children. The old way of thinking was that until they had a functioning memory, trauma didn't impact them. But now we know that life situations and experiences actually can start, you know, we know through developmental science that it actually starts impacting us in utero. And so there are 4 main areas of impact I'm going to go over today. So we're going to look at physical impact, psychological impact, emotional impact, and developmental impact. And when children experience separation, loss, and trauma, often their brains start to develop differently from children who feel safe and consistently cared for. And so they actually start to develop and grow and change in ways that those that maybe have got to experience support and safety throughout their childcare, they develop differently. And so while the effects of trauma are different for each person, there's no, you know, one size fits all. We know that the effects can be far-reaching and can influence every part of the brain, which then can impact how our body functions. And so trauma can impact our physical health as well as complex brain functions like our ability to learn or how we form relationships and engage in relationships. And so, you know, when we're looking at children, their responses when they're fearful or anxious are often rooted in survival instincts that protect them, that protected them when they felt unsafe. And so children will need adult support to help them learn new ways of interacting now that they are safe. So when we're working with families, we have to try to help them and teach them how to promote safety within their home, which we're going to go over that a little bit. Because what they need now is even though I think the old way of thinking also was if you take a child who's experienced trauma and abuse out of the environment and put them in a better supportive environment, then they'll just be fixed, right? It's like magic, and they'll be all better. But we know that's not how it works, right? We have to consistently work with the children to process things that they've been through. We have to get them the help that they need, and we also have to have our parents and caregivers develop strong and safe environments for them, so that they can start to cope and be able to learn better ways to handle their feelings and emotions, and not these survival instincts that they've had to use up until that point. And so parents who are fostering or adopting can help children manage these behaviors and heal from their separation, loss, and trauma by co-regulating and staying calm to help the children learn how to become and stay calm. And so not only is there this impact on children who have experienced trauma and they, you know, the impact of trauma and then the impact of being uprooted from their home and in a new environment, but it's also the impact on caregivers that they have to learn a lot of times a different way to engage with children. And so a lot of times when I was doing clinical work with families, I would get I'd get the response, well, I've raised kids before, you know, I've raised children before, I know what to do. But when you have children who have experienced different types of trauma, a lot of times they need to be parented in maybe a different way. And so what we find that the impact on caregivers is a lot of times they have to learn or relearn things that maybe they haven't used in a long time, or they've never had to use with their children, tactics they haven't had to use in the past. It could be too that they just haven't raised children in a while. Maybe their children are grown and now they're put in a situation where they either, took in foster children to care for them, or maybe it's a kinship care situation. And so it's a really big learning curve for them as well. And so there is the impact on children, and there's also impact on caregivers too. And I think giving caregivers the space to discuss that and really process the impact that it has is important as well, to kind of help them create that safe environment. And so it's really it really is an overall impact on both parties when we're working with children and families who are in these situations or who've experienced trauma in the past. So the first thing I want to go over is physical impact on children who have experienced trauma. And so trauma can have significant physical impacts on our body. And so some things that we know is, the first one is it can cause a chronic stress response. So trauma can activate this response in our brain and in our systems that leads to this prolonged release of stress hormones like cortisol. And this can result in chronic stress, which negatively affects, many of our bodily functions and organs, that just chronic release of cortisol. And a lot of people think, physical issues that research shows that some physical issues we go through do have roots in emotional issues that maybe we have experienced as well. And so it's kind of this idea that this chronic release of cortisol and this chronic level of stress directly impacts our organs and bodily functions in different ways that can directly impact our quality of life as well. And so the next one is it can cause issues with our cardiovascular system. And so chronic or prolonged and chronic stress from trauma can increase the risk of heart disease, hypertension, and stroke. It also can impact our immune system. And so chronic stress can weaken the immune system and make our body more susceptible to infections or illnesses. And I'm sure if you all have ever been, I know I have, if you all have ever been in a stressful time in your life where there's like no break and it is just constant, back to back to back things that you're dealing with or you're working through. And maybe you haven't noticed this in the past, but you'll notice it now. Often you end up getting more sick during those times. And you pick up things that normally you wouldn't pick up, different common colds, or maybe you just keep a cold, right, the whole time. And it's because we don't always put it together, but a lot of times it's because during these high stress times, our immune system is weakened and suppressed. And so we end up picking up sicknesses and illnesses that we don't always, that we haven't, we've been immune to in the past. So trauma also can affect our musculoskeletal system and cause problems. So it can lead to muscle tension, pain, fatigue, and this is due to the body's constant state of alertness from that chronic stress is causing an individual's body to be alert and overly alert. It's kind of that idea that they're always being chased by a lion, right? And it leads to this chronic muscle tension, which can then cause pain. It can cause migraines and headaches. It can make you really fatigued. Think about if your body is in a constant state of tension, right? You can see how your body would get more fatigued overall. It can also cause digestive and stomach issues, such as irritable bowel syndrome and other disorders of that nature. It can cause endocrine disruptions, so it can affect our hormone levels, leading to issues like thyroid dysfunction and metabolic disorders. And there are also neurological effects. Trauma can alter our brain function, like I kind of mentioned earlier, which can then lead to conditions like post-traumatic stress disorder, anxiety, and depression, and some of these mental illnesses and mental issues that we struggle with as a response of trauma too. So, if we're working with children or working with families where there's trauma, it's important that we encourage them to seek professional help if they aren't getting it already. Therapy and other treatments can help manage and mitigate the physical impacts of trauma. And it also can just give them a supportive and safe place and really an unbiased place where they can get information and knowledge and research that can support them through this time and kind of guide them through that. When we're talking about physical impact, I also like to talk about just some behaviors you may see. So we know the overall physical impact. I gave you, some of those examples, but there's also some specific physical behaviors that sometimes we see with children who have been experiencing trauma. So a lot of times we see them hoarding food. They, don't always tell the truth. They're defiant. Sometimes they pick fights often. That we may see angry outbursts. They may say shocking things. They may break things. This aggression, substance use. Sometimes, they run away. And so not only do we know there's this physical impact of on our bodies overall and our health, but there's also this physical impact of our behavior as well, and the impact that it can have on other people. And so those are some warning signs or things to look out for too. And I think it's important to share some of these things with families. That's what I would do in practice, is when they would be very concerned about things. Sometimes it's nice just for them to hear that this is a common symptom or behavior that people who've experienced and kids that have experienced trauma have experienced and went through. And so just to know that they aren't alone in that, and that it is something that, a therapist or a professional can work with them on, is encouraging, because sometimes they feel like they're the only people going through, this certain situation, or their child that they have is the only person going through this. And being able to connect the dots and show them how trauma has impacted these different things, and that there is hope, can be helpful to caregivers and families as well.
Dr. Archie,
Yeah.
Garrett has just made a comment which ties into what you were talking about a person's perception and capacity to tolerate trauma is an influencer as well.
Yeah, for sure. So, and different people have different capacities dependent on typically their experience in the past, right? So what they've been through, or maybe what they have experienced in the past, can directly impact, like you said, their capacity and their ability to, show up in that way and tolerate these different situational issues. So, and situational tolerance is different for everyone. So one person perceives an issue as in a more detrimental way from another. And this kind of lends itself to client-centered model we're all familiar with. Exactly. I was actually just talking about the person-centered model this morning. As social workers and different people in the helping, profession, that I know we're all from different fields of the helping profession, but we help people. And when you're in a helping profession, you do have this person-centered tactic and goal with each of your clients that are patients and children that you're working with, that you don't serve them in the exact same way, right? You don't treat them or provide interventions in the exact same way. They may have the same issue, or like when I was doing clinical work, I may have two children who have the same diagnoses, but that doesn't mean that I treat them or provide the same interventions to each of them, because they have different needs. They have different supports. They have different lack of supports. They have different things that they need in their environment. And so it's not really conducive to their treatment overall that I, provide them with that. So we want to make sure that we provide that client-centered treatment overall. So, that was a great comment. Thank you, Garrett, for sharing that. Now, after we talked about some of the physical impacts, there are emotional and psychological impact as well that we see. And these are some examples of internalizing behaviors that we see with children who have experienced trauma. So often they'll withdraw, shut down, they'll be sad and tearful. At times they'll be moody. They may have nightmares or trouble sleeping, toileting problems, unhealthy eating, frequent headaches or stomach aches, cutting, and other types of self-harm. They may be clingy, peer problems. So maybe they have issues socially, making friends or keeping friends, or they may struggle with suicidal ideation or self-harm, like I mentioned earlier. And toileting problems, a lot of times people, I just want to touch on that really quick. When you first experience a child who has maybe issues with regression and potty training and things like that, our first response is, some kind of sexual abuse. And that is a warning sign of sexual abuse. But regression in potty training can actually be a sign and symptom of any kind of trauma. So I would have children who, if they were going through any kind of impact in their lives, they would regress in potty training. And so, like, if their parents were going through a divorce, or if they lost somebody in their life. And so it's not just abuse, but it's really any kind of trauma or loss or separation that we can see a regression in some of these behaviors overall that they've experienced. So emotions, when we talk about emotions and internalizing behaviors, we know emotions can be contagious. And so that's why self-regulation for parents and caregivers and us teaching that is really important. So, when we're working with a family who they're parenting a child who's experienced trauma or loss, they will require different characteristics. They'll require resilience and patience. They'll require attunement to the child and their needs, a tolerance for rejection. So they have to be able to not take things personally, right? And then also just a commitment, an overall commitment to this child and their overall well-being, no matter, what is thrown their way. And behaviors of children who have experienced loss and trauma, a lot of times are perplexing to adults and caregivers. And so, it's hard for them to kind of decipher or understand because they just they don't have the knowledge or the education of maybe what's going on. And that's where we can kind of step in and help them understand that and bring awareness to those things. And so parenting a child who's experienced trauma and loss requires, like I said, them to be attuned to the child's level of functioning. And that does take a great deal of commitment from the parent to understand what is beneath these behaviors, whether it's physically or emotionally or internalized, what's beneath them rather than just reacting to the behaviors, right? We want to get to the root of these behaviors, not just punish every behavior. Rather than learning how to relax from their caregiver, as children often, other children learn to do. Children who have experienced trauma and separation learn distress from their caregiver because they haven't came to meet their needs, or perhaps they've lost them in some way, or they've hurt them in some way. And so they've learned that caregivers don't show up when you need them. And they don't relax around caregivers. A lot of times that they're actually in more of that fight or flight hyperarousal mode when they're around caregivers. And so it takes time to kind of undo these habits and these survival instincts that children have had to hold on to up until this point. And parents and caregivers, they need to be encouraged in that, and they need to know that it will take time, but that there is hope. They need that message of hope that it will, and with that consistency and commitment, they will be able to overcome these things that they're struggling with right now. And oftentimes when a child has learned this distress from their caregivers, they have been trained to be fearful, defensive, in survival mode, and that's kind of their starting place. Rather than a moment, just passing through, they kind of stay in the survival or defensive place. And this is different than a child who's developed more typically. A child whose brain and body learn that distressful moments happen and that, they can depend on people and people support them and they trust them. They'll be able to relax again after that, distressing or hard time or emotion rises. But children who have not experienced that supportive environment, when a distressing time happens or a hardship happens, they don't know that it's passing, and they don't know that they can get through it. And so they have to learn that, and parents have to kind of come in and help them and come alongside them and help them through that. So, if you fast forward a few years and a child with a more typical background, they may experience minor stress and not be too bothered by it and get over it quickly. Whereas a child who's experienced trauma or loss or separation, they can't get over it, or they get stuck in it, or they have this chronic stress about them and they aren't able to cope with it effectively. And so there are two major adaptive strategies that I have, the last two bullet points on this slide. Hyperarousal, which is just fight or flight, that fight or flight response I'm sure we've heard of, and then dissociation, which is a freeze response. And so these kind of work together to help us cope with stress, distress, and traumatic stress overall. And these adaptive strategies are interactive, and their sensitivity, can be modified or increased by chaotic, unpredictable, or severe stress and distress. Or it could be decreased by opportunities for them to, understand how to cope and work through those things and realize that these things and these symptoms pass, and they can work through those things. And so parents being able to understand and see when their children get stuck in fight or flight, hyperarousal, or freeze with a dissociation, and being able to help them regulate and be able to work through whatever's caused that stress and understand their triggers that lead them to those symptoms and that impact is beneficial for them and teaching them on how to handle that effectively with their children. The next thing is developmental impact. And so while no two children are alike in their development, there are the approximate ages at which, milestones are typically attained. And this range of being on target in some, this range of being on target in some areas ahead, in other areas, sometimes they don't reach milestones in other areas is typical in development. There's kind of this give and take that, and usually when you see milestones, there's a broad, usually age range, because, some children achieve it earlier, some children achieve it later, but it's still considered that typical milestone and age range for that development. And these skills, continue to develop actually through late adolescent years and beyond. But, if a child has experienced a traumatic event in early childhood, it can impact that development and delay it later. And so consider what it would look like if a traumatic event, occurred during early childhood phase. So let's say for a 3-year-old child. So maybe they've experienced delays in development at age 3 due to a trauma they've experienced. And in that case, it will also affect, right, if they haven't met those 3-year-old milestones, then in turn, it's going to affect milestones at ages 4 and 5, the middle childhood stage. And because these skills build upon each other. And so if trauma is impacted and delayed certain milestones, then it's going to directly impact the milestones in the next stage of life as well. And so we kind of understand that for a child who's experienced trauma, there may also be delays that are experienced in some areas, but not in all areas. And so if this 3-year-old child was impacted by trauma, maybe they'll achieve physical milestones, right? Maybe they're growing on time, maybe they're in the right percentile for height and weight and things like that, but they have delays emotionally and cognitively. And if there's no intervention and the child, can't catch up for a long time, you can see how it would affect their overall developmental picture and behavior, even though they're still maybe progressing, appropriately with growth and physical milestones. And again, these delays might happen in only one area, or they may occur across developmental areas. Another example might be that a child may be developing at their age level in large motor skills like walking and running. Maybe they're doing that well, but they have delays in their speech development, and they may need some help in this area. And, another child may be ahead in cognitive abilities. Let's say they show signs that they're an early reader, but maybe they're less developed in social skills. They have trouble, engaging with peers, and they have difficulty getting along and playing, in preschool or when they get into school. And so these delays require the parent to change and modify parenting to better support the child's growth and learning overall. And oftentimes we may have to, when we're working with children and families that are at these stages where they're struggling in different areas of development, it may take our part to educate them, on what typical development is and what that looks like, and give them some tips or connect them, if you're a social worker, we connect them and fill those gaps for them, the different resources they need. Maybe they need to be, we need to try to get them set up with occupational therapy, right? If we can get them connected to that. If they're struggling with those motor skills. If we're a school-based, I was a school-based therapist for a while. If I had a child, that was struggling, I would always go to their IEP meetings and suggest, I'm seeing issues with this, or, different areas like that. They need to, suggest this. And so we really try to understand these things so we can advocate for our clients, advocate for our families, and also just educate our families on what's normal development, how they can advocate for their children as well, and equip them with the ability to do that so that we can promote their overall well-being and learning overall. And so it's crucial that parents recognize these delays and, a child's inability sometimes we hear the term, they aren't acting their age. And a lot of times that's not because they don't want to, it's because, they can't, right? It's important to engage with professionals who can help to develop strategies that will assist them in overcoming these gaps that they have in development. And it's essential that parents, who are in this caregiving role, take extra care to provide the child with a sense of safety, predictability, and protection in order to continue to develop these things. We want them and we want to equip these parents to provide rich developmental experiences to help the child make progress towards, these goals. And so we also want to remember that when you're concerned that a child may be experiencing developmental delay or a regression, that's another thing, like I talked about with toileting, maybe they've met this milestone, but now because of a trauma, they're regressing on it. And so it's important that they, parents and caregivers ask for help from a professional skilled in understanding child development. So like a caseworker, a physician, a psychiatrist, a nurse, a teacher, a psychologist, right? It's important that they have everybody at the table that they need, right? And sometimes it's us equipping parents or educating them on what that looks like so that the children have these different professionals that they need for their development and to intervene in those ways to bridge those gaps. And children with developmental delays are likely to have a developmental age that's different from their chronological age. And so that's important to know and to educate parents on too. So just because, I have a 9-year-old child, that presents to my clinical practice or is seeking treatment in some way, because that's their chronological age, because of trauma and different things they've went through, their developmental age may be different. And it's important that parents recognize that too, and we educate them on that because knowing that will help us curate our response to those children and the interventions we use, and then the parents' interventions they use at home as well. Because the reason the 9-year-old may not be responding, right, to these things that we're doing in the home is because developmentally they're really still 5 years old, right? And it's important that we understand that. And it's important if you're working with children too that you understand that. I did this a lot when I did school-based therapy. I may have, for example, I may have 2 fifth graders that both have an ADHD diagnosis. They're the same age, the same diagnosis, right? But it goes back to that client-centered, person-centered treatment that their developmental ages are different, maybe, and what they're ready for in treatment is different. And I have to curate my treatment plan and interventions to that. And so teaching parents this idea that just because they're this certain age doesn't mean that developmentally they're ready to be responded to by that chronological age. And so, for example, you may have a 15-year-old, a parent may have a 15-year-old child move into their home from foster care who physically looks 15, but emotionally they're behaving like a 9-year-old. Socially, they may be more like a 7-year-old, and cognitively, they may be more like an 8-year-old. And so helping parents, recognize that the chronological age doesn't always match where the child is developmentally. And that's crucial because once this recognition is made and accepted, parents who foster or adopt or have children in their care who experience trauma can adapt then to their demands. And they not only their demands of the child, but their expectations of the child, right? It's not fair to this 15-year-old for me to expect them to emotionally or socially achieve things, right, that a normal 15-year-old would because developmentally they aren't there yet, right? Now we hope we can get them there. That's the goal. But it's important that parents recognize that they need to kind of adjust their demands and their expectations to their developmental age and not their chronological age. Because that will help them meet their child exactly where they're actually at and where their developmental age is at and what they need. And so by doing this, parents and caregivers and professionals are being emotionally supportive and nurturing the child and reducing the tendency to have these unrealistic expectations of the children that they just can't live up to, right? And kind of setting them up. Sometimes we set them up for failure without realizing it because they can't meet these chronological age expectations yet. We need to kind of scale back and adjust our expectations and demands to their developmental age instead. So these are just some core principles of trauma-informed care that when I talk about trauma-informed care, I like to always go over. And so trauma responses, you know, they vary widely, but there are some common examples and ways to recognize triggers. And so the first thing is sensory cues, right? So triggers, when we're talking about triggers, triggers are stimuli that remind us of the trauma and remind children of the trauma that can cause this intense or emotional or physical reaction. And so sensory cues, these are certain smells, sounds, or sights that can trigger memories of the trauma. So for example, the smell of a particular perfume or the sound of a specific song could trigger trauma for the people that we work with. So I know, and a lot of you, if you work for an agency, a lot of times they enact these different trauma-informed care things, you know, policies within their building. So I know when I did outpatient treatment, you know, we couldn't have like a Scentsy thing in our offices because, you know, if we had a certain smell in our office, right, like cinnamon, vanilla, it seems harmless to us, but someone who's had some kind of trauma and maybe had that smell around them at the same time, maybe their house, you know, the house that they experienced a trauma in always smelled like vanilla, right? If I have vanilla in my office, that's going to trigger them. That's going to be a sensory cue. And so we could not have any kind of sensies in there. We couldn't, you know, have any other kind of sounds or sights. You know, there's certain things we could have on our walls because we just wanted to be really aware that things that may seem, you know, harmless to us or not a big deal to us, to a client who's had that in the background or has seen that or experienced that in some way while they're experiencing a trauma, can be triggering for them. And so we want to when we're trying to work with our clients through their trauma, we want to try to minimize their triggers as much as possible, right? And we want to help them have an environment that they feel safe in, and that is conducive to our treatment. And so if you don't work for an agency that has those policies, I encourage you to enact some of those policies within yourself and within your own office space, because that really does make a difference. Another aspect of recognizing triggers is emotional reactions. And so these are just sudden feelings of fear, panic, or sadness without an obvious cause, can indicate that this is a trigger, right? So if you have children who all of a sudden get emotional, right, and they may not even know why they're getting emotional, right, or why they're anxious. But as a parent or caregiver, we can see that, and we can see that there's something that's triggered them, right? So you know, let's say you have a child that they just came from a foster home where their mom always, cooked eggs for breakfast. Okay. And they had experienced a lot of trauma in this home, but their mom always made eggs for breakfast, right? So let's say that they come to you and you're just, you've had them for a week, but you haven't had time to make breakfast, but it's Saturday morning, you're like, I'm going to make a full breakfast, and the parent makes eggs for them, right, as one of the things. And all of a sudden the kid gets really angry and then sad right at the table once it sees eggs. If I'm a parent, I'm just like, you're being disrespectful, right? You're not appreciating me and the work that I put in to make these eggs. But if I'm a trauma-informed parent and I know what this child has experienced in the past, and I recognize that this was a sudden feeling of anger and sadness, that there's something on this table, right? Or something about this experience that has triggered this child. And I need to start to peel back the layers with them. And so teaching parents that, and that goes back to you can't have these feelings of rejection, right? I can't be on the defense and be like, oh, well, you're disrespecting me and you don't appreciate what I've done and da-da-da. I have to recognize that there's something that's triggered them and I need to help them regulate and co-regulate. And then when it's appropriate, try to talk to them about it and us try to problem solve together about what triggered them. Like I said, that child may not even have known and it really consciously understood that the eggs are what triggered them, but subconsciously it reminded them of their home and their mom, and now they're angry they had to leave and they're sad they had to leave their mom, right? And so it's recognizing those things. Another aspect of recognizing triggers is recognizing physical symptoms. So and I know you all have probably experienced this. If you experience any kind of stress, A lot of times you'll have rapid heartbeat, sweating, you feel tense, can be signs that you've encountered a trigger. And so I had a job once that was, it caused me a lot of anxiety and stress. And at the end of every day, I had a pretty long commute. I had like a 45-minute commute home. I would get home and realize, without even realizing it, but by the time I got home, I realized I had tensed my shoulders up the whole way home and I had furrowed my eyebrows the whole way home. And I just had this, and I'd clenched my jaw too. And so by the time I got home, my neck was kind of hurting, my jaw was kind of hurting. I had a lot of TMJ issues during this time. And it was because I was having this physical symptom of stress and I was being triggered by, you know, it's causing me anxiety. And I had to learn how to cope through that. I had to learn that on that drive home, I needed to maximize that time of self-care and actually decompress and not just sit in it, right, the whole way home. And when I started to recognize these physical symptoms, I was able to cope with them and process them and try to use that time to decompress and not sit in that stress. And so parents and caregivers need to recognize these physical symptoms within the children that they're working with that have experienced trauma. And so if they see, you know, that they are tense or that they're struggling with these physical symptoms, they help them kind of cope with them and recognize what they are. Another thing is behavioral changes. So avoiding certain places or people or engaging in compulsive behaviors can be a response to triggers. And so, and sometimes, you know, we have to help you. I think a good clinician and a good professional helps clients recognize when there are behavioral and people or places that they can avoid, and there's things that they can, right? So, like for example, I had a child that I was working with them. They did not want to ride the bus ever, and it was because one evening after school, the bus driver passed their house on accident and they fell asleep on the bus, and 30 minutes went by and they realized they woke up and they had no idea where they were at, and they were still on the bus and they knew they probably shouldn't be, and they were not anywhere near their home, and they were on a route that they had not seen before. And then they went up and told the bus driver realized, right, that they had fell asleep and they'd missed their stop. And so the bus driver took them back, you know, once they were able to get back on route to that. And to us and to an adult, we're like, that's not really that big of a deal. But to that child, that was scary for them because they woke up and it was unfamiliar, and they didn't see, you know, familiar things around them. And, you know, they trusted that, you know, the adult on the bus was going to get them to their house. And, you know, then it took a lot longer and all these different things at play. And so they wanted to avoid riding the bus. They never wanted to ride the bus again. But because of their parents' jobs and things like that, they had to ride the bus to their grandparents' house. They couldn't, like, people couldn't take off every single day to pick them up from school. And so I had to help the child overcome that trigger, right? And overcome that issue. Now, if there is a person that's triggering them that is, you know, abusing them or causing some kind of harm to the child, then we would separate that as much as possible. That's not something they need to overcome. That's something we separate them from to keep their safety, right? And so it's kind of having this wisdom and discernment on when we need to help our clients and parents and families overcome these triggers because they can't avoid them, or when we need to create barriers to where they can avoid them because it is causing them harm and not, you know, promoting safety in some way. Another core principle of talking about trauma-informed care is not only recognizing triggers, but looking at trauma responses. And I touched on this earlier, but fight, flight, freeze, and then there's also one that's called fawn, which is a newer one that we talk about that's important. And so fight, you know, we're talking about that hyperarousal. Fight is when we get aggressive, and a lot of times it involves confrontation, and a lot of times it can manifest as anger, irritability, or just really this overall need to control the situation. So you'll see maybe children try to just control or get angry, or maybe they have acting out behaviors because they're trying to get some sense of control back. And that's because they've been triggered in some way and they're having this fight response. The second one is flight, and this involves escaping or avoiding situations that remind you of the trauma. And this can show up as anxiety, it can show up as restlessness, or it can even show up as a tendency to like obsessively avoid, right? Or overwork to try to avoid whatever they're trying to fly from it, right? And so they're trying to escape it in some way or avoid something that is reminding them of the trauma. The next one is freeze, and a lot of times this is, this is linked to dissociation, and this is characterized by really just a sense of feeling stuck or unable to act. And so, like I said, it leads to dissociation. A lot of times it leads to numbness or just this sense of helplessness for children and people and families. And then the last one is fawn. And this involves people-pleasing behaviors to avoid conflict or gain approval. And it can result in neglecting your own needs to keep others happy. So it's kind of putting yourself on the back burner. It's this, like this overarching thing of just people-pleasing behaviors because you are avoiding conflict at all costs to gain approval. Because that's all of these things. The common theme between all of these trauma responses is the goal is to keep them safe. They've figured out different ways to keep them safe. All these things on the outside, they've had no control over. This trauma, they've had no control over it. So the way that they've found to keep themselves as safe as possible, the only thing they can control are these trauma responses. So they know the only way they feel like to keep themselves safe is to control or fight or get control of the situation, right? Or it could be to flight, to escape or avoid. Or it could be to freeze, where they just totally go introverted within themselves. They block out the whole outside world and they are numb. That's the only way they can keep themselves safe. Or fawning, they realize that the only way to keep themselves safe is if they avoid conflict at all costs. And a lot of times they'll feel like it's their fault if there's conflict because they neglect their needs to keep other people happy, to keep themselves safe. And so these are all very common responses that we see when we're working with people and children who have experienced trauma. And so we want to educate our families and parents on what these things look like, why their children may be engaging in these behaviors, and how they can overcome those things. So just a couple of things that, I usually promote when we're talking about managing some of these triggers is grounding techniques. So focusing on the present moment by using our senses. So I'm sure you all have heard of the 5 senses grounding technique, which is where, 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. And so I would always guide my children and even, when I worked with adolescents and adults through this, because when you're triggered in some way, it is really hard for anybody to think clearly, right? And make clear decisions when you're triggered and you're having these emotional responses. And so kind of the first line of action when you're triggered and when you recognize you're being triggered is to regulate, because you're not going to be able to make a sound decision until you first regulate. And that's where grounding comes in. And mindfulness is because it's not that grounding and mindfulness take away all of your problems or take away your feelings of anger or stress. It's that it helps you come to a more regulated state so you can make a more informed decision. And so we have to teach our children that as well, that because I think sometimes too, we're like, well, grounding doesn't work, mindfulness doesn't work. That stuff is just, that's a waste of time. I think it's because we have this unrealistic expectation that it's going to take away our trigger or it's going to take away our anxiety or our feelings. And that's not, it doesn't take it away, but it helps us regulate so that we can cope through the feeling and make choices and better choices from that. And so it's a tool. Mindfulness is just the practice of staying connected to the present and reducing the impact of triggers. So once we've grounded and kind of helped our bodies and our senses regulate, we can be mindful and help our children be mindful in the fact that, and recognize that, okay, like I was triggered because of the trauma I experienced in the past, but I'm not being traumatized in that way in the present, and helping them recognize that and stay in the moment and stay within this day, right, in that present moment, so that it can reduce the impact of that trigger. And so they can recognize that they're safe and they're taken care of, and that they're not actually, they feel like they're experiencing it, but they aren't actually in the moment experiencing that trauma that they're being triggered by. And then therapy and just professional help, like I said, a social worker, a clinician, a psychiatrist, a nurse, a teacher, whatever, that therapy profession looks like, working with somebody and bringing everyone to the table that's going to support them through this and help them manage these triggers effectively, and reduce their impact and help them just live, a better quality of life overall. And so understanding and recognizing these responses and triggers a lot of times is the first step in healing. That is where I would always start with children, and families, is first helping them recognize what's triggering them and really peeling back these layers, because I would have children and families come into treatment where all they would do is complain about these negative behaviors they had, right? They're picking fights at school, they're being defiant towards authority, and because a lot of times all we see are the symptoms, right? But we want to help them peel back the layers and figure out what's causing these behaviors, right? What's triggering these behaviors? And how can I teach families and other individuals on how they can cope with these things and also provide a supportive environment, so that the children can cope through these triggers, within their lives. So just some core principles of trauma-informed care. So we want to create safe environments. So when children don't feel safe, a lot of times their arousal levels go up and their trauma responses kick in, like we talked about. This is where we see fight, flight, freeze, or fawn. And children need to know and feel that there is a safe place where they can go. It's important that parents who are fostering or adopting or have children in their care that have experienced trauma, separation, or loss can be a difference between, and they understand that there's a difference between physical safety and felt safety for a child. Like I said, a lot of times we think that just because we, take them out of the unsafe environment and put them in a safe environment, that all their problems should go away. But it takes children a while, although they're physically safe, it takes them a while to feel safe. And so we have to help parents understand that there's a difference between physical safety and felt safety for our children. And so a child who's experienced trauma may have trouble feeling safe in most places. Even when we can't see any apparent danger, the child who's experienced the world as a dangerous place will carry this fear and worry with them. And it may take more time and support for a traumatized child to have felt safety in certain situations. And their behavior will reflect their fear until they feel safe, until they have that experience of safety. And felt safety can be developed when a caring adult modifies the child's environment and learns how to respond in a way that helps the child feel safe. So to do this, parents who have children in their care, who have experienced trauma, need to continuously show trustworthiness to the child. This will entail doing what you say and keeping your promises and really just being predictable. And home should be a safe place, a place where children will not be harmed or be at risk of injury from others. And the home should be a place that the child feels comfortable to be themselves and know that they will receive support, acceptance, and consistent care no matter what. And this unconditional level of safety and care. Ideally, there will be several spaces in children's daily lives where they feel safe, such as their school, faith-based or other community spaces, with relatives or trusted friends or neighbors. However, when a child comes into a new situation, such as a new home or school, it will take time for them to feel safe. And so modifying their behavior to feel safe in a home can look like providing a schedule, a very consistent structured schedule. Consistency and predictability can help a child feel safe. Oftentimes, a child, experiencing anxiety when they are faced with uncertainty. And so a schedule, should be shared with the child if age appropriate and written out in place where it's accessible to all. And I have seen this actually play out, in treatment. I had this one family that comes to mind where they had a child who'd experienced trauma, and they were having very negative behaviors and emotional outbursts at home. But the odd thing that the parents kept coming back to was at school, this child hardly ever had any outbursts or negative issues. They actually, did really well at school. And what we found was it was because the child, the teacher at the beginning of the day had the schedule written up on the board, and that teacher stuck really consistently to that schedule all day at school. And that provided this level of safety for that child. And just they knew there was no uncertainty. They knew exactly when and what was going to happen and where. And sharing this with the child throughout the day, and it was in a place all day, right, in their classroom that they can see, and it was accessible, helped them feel safe and had this level of predictability. And so I encourage the family to try to do a similar thing in the evenings after school, to have a set schedule that they followed, Monday through Friday in the evenings, and they had it maybe on their fridge, and so that they knew, and they tried to stick to it the best they could each day, and so that the child knew this predictability for that. And life happens and things happen, and so you can't always stick to those schedules. But if you know or you perceive that there is going to be a conflict in your schedule for that evening or that day, communicating that with the child, and letting them know, hey, there's going to be a change to this schedule, that really makes all the difference in them feeling safe and secure, and also just in the know and having access to that. And as part of safety and scheduling, rituals and routines can help children feel safe as well. So having a routine, having a routine way to get ready in the morning. So maybe they lay their clothes out the night before. Maybe they have a certain breakfast routine, and also at bedtime. So maybe, at bedtime, you all sit down and talk about the next day's schedule. Maybe you read a book together. Maybe, you say prayers before the lights out, or you do some kind of grounding or mindfulness technique, anything like that. But some kind of ritual routine that allows the child to know what to expect can help them increase their felt safety as well. And routines and rituals, that's going to be unique to each family. And the importance is not so much about the details of the routine you choose, but rather that there's a consistency and predictability with the routines and rituals that work best for your family, that allow children to feel like there is structure and order within the world around you. And you'll sometimes when you get online and on social media, it can be overwhelming because everyone's like, here's the 12-step nighttime routine, right? You should be doing with your baby, or you should be doing with your child, or da da da. And it's not, those aren't always realistic, right? So you want to find, it's not so much, like I said, about exactly the details, but it's that you do something, right, in a routine at night and in the morning, and there's this predictability that's being put into place in the home for the child. And it's important that, because this helps them have that felt safety. A different parent, other parents may choose to sit down and eat meals together. That's their routine. We always eat dinner together, or we always eat breakfast together. While another may pause at night to discuss, like I said, the day that's ahead at night, so that they know what to expect the next day. And it's important that we, before they get into these routines, that you all, make a plan for them. So maybe you include them in that planning process, right? So you have like a family meeting where you all come together and say, okay, what are some attainable routines or rituals we can do in the morning and at night, and include the children in that planning process. It can be meaningful, to them to be able to create or revise rituals or routines in their home and feel like they have some kind of control, especially if they've been uprooted from their home in some way. They feel like everything's out of their control. So giving them a little bit of say, or giving them a little bit of inclusion of what you all are doing and the rituals or routines you're engaging in, can help them feel accepted, and also like they have a little bit more control over their life again. And it can help them decide on what's comforting and what's best for them overall, and that they just belong. So children, they need this support of a nurturing and safe and stable environment. This change is not going to happen overnight. It'll take time and hard work from parents who are in this caregiving role. And structure and consistency, like I said, are key to creating this sense of felt safety. But we also have to balance flexibility and compassion to adapt to a child's needs when necessary, and when they are struggling in that way. So children may have behaviors that are challenging to manage, and so we want to have that commitment to them as well. But like I said, also the flexibility that the evening or night routine may not go exactly how we want it, and communicating that with the child. Or if they're having a really hard time one day, being flexible that, okay, we don't have to stick to that routine this morning, right? And kind of choosing your battles in that way is okay too, and having compassion that, the child's needs may change day to day, and being flexible within that as well. Despite a parent's best attempts, life will never go perfectly. Upsetting things happen. And the most important factor in a child's ability to tolerate adversity is having a supportive relationship with a healthy adult. And so, we're talking about collaborative support. Having that supportive relationship with a healthy adult is crucial. And this is particularly necessary for children who have experienced separation, loss, and trauma in any way. Ideally, the child should feel that the parent, who is in that caregiving role is someone the child can turn to for support, but it's also important that they find other, safe and supportive environments, and supportive adults. So that could be in extracurricular activities, from a teacher, a coach. It could be maybe respite care, for the weekend, or community programs, that they can get involved in, maybe after school programs, outreach programs, different things like that, but really trying to seek out and provide that with them. And as a professional that's working with a family, it's important that we know the resources in the community so that we can uh, connect them to them and bridge those gaps for them. So they may not know, right, that there's a parenting support group at the extension office, or they may not know that there's a free music class they can take their children to once a month on Saturdays, and they can enroll them in. They may not know that they can get them involved in, piano lessons, or they can take them to the library during reading time during this day, or so on and so forth. And so helping them find these different supports for them and for the children is important, and kind of developing these healthy relationships in the community, and also getting them involved in activities and providing that support not only for the children, but it's also going to provide support for the families and the caregivers as well, because they're going to be able to connect to other parents and other caregivers too. So finding that and kind of having that collaborative support is crucial. And so when we're talking about this, there is one skill that I always like to teach, and it's the 3 R's. And you all may have heard of this before, but it's regulate, relate, and reason. And so when you're working with children who've experienced trauma, this is a great framework to teach parents and caregivers, and also to enact with parents and caregivers and with children. And so first, we help the child regulate, then we help the child relate, and then we reason with them. And so a lot of times what we end up doing is we jump straight to reason, right? This is why you shouldn't do this. This is your consequence, da da da. And we miss these, and we wonder why they aren't responding well, right? And it's because we haven't taken time to regulate not only them, but ourselves. We haven't taken time to relate and understand what has triggered them, what the issue is. Because if we miss those 2 steps, then when we get to the reason part, they typically don't respond very well. And so when a traumatic response is triggered by a child, a lot of times, like I said earlier, they become overwhelmed and they're not able to think clearly. And as adults, we're the same. When we have been triggered by something, we make bad choices a lot of times, and we're overwhelmed and we're not able to think clearly. And so the child may engage in overdevelop this fight, flight, or freeze, fawn behaviors. An adult who responds to this traumatic reaction by yelling at the child or immediately punishing the child is usually not going to help the child calm down. In fact, that may help the child, perpetuate their behavior or overreact even more. And oftentimes it'll make the situation worse, because what happens is the parent's getting more dysregulated, the child's getting more dysregulated, and everything just keeps escalating. And so for children who've experienced trauma, separation, or loss, punishment will likely escalate a situation and not solve it. And these children will need help regulating before they can have any conversation or put in a consequence. And so in these situations, parents who are fostering or adopting need to regulate themselves first and try to identify what might have caused the behavior, which is where you relate, and then we want to help the child also regulate and calm, and so that they know they can turn to us for support. And it's important to find other safe and supportive adults that are available in places when the parent is not present. Like I said, a teacher, a coach, or neighbor. So for an example, let's assume a parent who's fostering or adopting, or is in a caregiver role, is up in the middle of a winter night and checks on a sleeping child who's kicked off their covers. As the parent is pulling the covers back up, the child wakes up. And the child who has a history of being sexually abused at night now screams and hits the parent. The parent who has done nothing wrong should not let the child continue to hit. However, Yelling at the child or punishing them will not calm the child down, nor will it help them get back to sleep or help them have this environment of felt safety. A better approach would be this idea of regulate, relate, and reason. And so when a child who's experienced trauma is triggered, responding to something with fight, flight, or freeze or fawn response, their whole body is reacting, and often they're in survival mode. And so as discussed, earlier, and when we talked about some of the physical things, they have an increased heart rate, blood pressure, a lot of times they're breathing faster, and all these can change when a child has experienced a trauma trigger or fearful in some way. And, they're not able to have a rational discussion or understand really why they're being punished because their body's experiencing these physical reactions and they're very escalated. And so the first step that we must take is to help the child calm down, which is regulate. And so in the example where the child awake, I talked about earlier where the child awakens and starts hitting the parent might step back out of range to stop the hitting while assuming the child they are safe, and reminding them they're safe and encourage them to take some deep breaths, work on some of these grounding and mindfulness techniques, or count to 10. And then once the child has calmed, then we want to try to relate to them. And it's important, for the parent in this situation to emotionally reconnect with the child and try to understand what upset the child. And maybe what has startled them in the night. The parent can remind the child of where they are, who's in the room, and reassure them that they are safe. And the parent needs to continue to reassure the child they are safe, they're in a safe place, and try to focus on how the child is feeling. So, trying to help them identify, are they feeling scared, anxious, angry, sad? What feelings are they experiencing? And in doing so, the parent needs to be aware of their own tone, and their own volume and proximity, and make sure they are calm and regulated as well. And once the parent has helped the child regulate their behaviors and has emotionally reconnected and kind of related and understood what feelings they're experiencing and what may have triggered those things, then they can talk to them about what happened and develop a plan to address the issue. And so in the example that I gave, once the child is calmer and listening to the parent can then explain why they were in the room. The parent can focus on soothing the child and getting them back to sleep. And then, after a good night's sleep, the next morning, they may talk about how to handle this situation in the future so that the child is not cold at night and so they aren't triggered. And these discussions, kind of engage this highest level of the brain and this emotional part of the brain with thinking and learning, and can happen only after the child has been calmed and emotionally engaged. And also the parent or caregiver needs to be calm and emotionally engaged as well. And this is why it's important you work through the steps in order: regulate, relate, and then reason. And so to help a child who's experienced trauma, a parent must be able to self-regulate, like I said. And this can be challenging when the parent feels the child is intentionally provoking the parent. And that's why you have to not take everything personally and not take everything as a rejection. And you have to recognize and remind yourself that they are just acting out of their trauma and trigger, that this isn't something specific to them. And it's not something that the parent or caregiver needs to take personally. And they need to remember the 3 R's, maybe themselves, that they need to regulate, relate, and reason themselves before they help the child regulate, relate, and reason. A child who's experienced trauma can recover, but it will take time and it's going to take patience. And that kind of goes back to that overall commitment that parents need to have as well. And so the last thing we're going to talk about today when we talk about trauma-informed care and we talk about trauma-informed parenting and caregiving is preventing burnout. And so burnout is, and compassion fatigue is when we're physically, mentally, and emotionally exhausted after a lengthy period of overwhelming caregiving stress. And so caregiver burnout, and this is what caregiver burnout is, and when it's left unattended, chronic stress can lead to the state of burnout and puts us at risk for a wide range of issues. These issues that can affect, the caregiver or parent's physical and emotional health, such as depression, anxiety, and physical ailments themselves. So all those things we were talking about, like where stress can cause them to have those things as well. Illness, issues within their organs and body and all those physical ailments. And when an individual reaches burnout, healthy and effective parenting usually is not possible when they're in this state of compassion, fatigue, and burnout. And so this is why managing parents and caregivers managing your own stress levels is crucial and it really is just as important as managing the child's needs as well. Because if they can't take care of themselves and make sure they're preventing burnout and compassion fatigue, then they aren't going to be able to, productively care for the child as well. So it's a necessity. And so a little, list I like to go over with parents when they may be reaching the state is, the first question is, do you feel chronically tired, exhausted, or generally run down? Do you feel like you're more easily frustrated and irritable a lot of the time? Are you noticing more difficulty sleeping? Do you find yourself overreacting to annoyances? Have you lost interest in things that used to be important to you? Have you noticed new health issues or concerns? Are you increasingly resentful? Have you started neglecting important responsibilities like doctor's visits, self-care, school appointments, meal prep, etc.? Are you using substances more than usual? Have you lost your appetite? Are you overeating? Do you feel isolated? And usually if parents have said yes into any of those, that's the indication that they are starting to struggle, or they are struggling with burnout or compassion fatigue. A lot of times people who are struggling with this have a low energy level. They just feel run down. Like I said, they're getting sick more. They don't feel well rested. Even if they've slept 10 hours, they still don't feel rested. They start to neglect their own needs and the needs of those they're taking care of. They're either too busy or don't care anymore. They can't seem to relax. They're impatient or irritable. And they just have this sense of hopelessness a lot of times that things aren't going to get better. And it's always going to be like this. And so some suggestions I always give is first to practice acceptance. Caregivers need to practice acceptance. So avoiding the pity or blame game, not dwelling on things they can't change. And, they made, we are a caregiver and that is where we're at. And so trying to focus on the positive reasons behind that, and that will help them reduce those feelings of resentment and burden. I usually try to help them look for the silver lining. So find the ways that being a caregiver has made them stronger or brought them closer to the child or family. Using a sense of humor can be helpful during this too. So really helping them find the positive things. Because a lot of times when parents have been taking care of children who've experienced trauma in the past, they may feel like when they get to this place where they're like, it's never going to get better. The child may have improved in different ways or overcome things in certain ways, and they've missed it because they are burnt out, or they're maybe they have unrealistic expectations, they're just struggling overall. And so I always like to kind of look back, reflect with the parents and caregivers from the beginning, and think about and help them really reflect on any improvements or any progress that their family and the child has made overall. And a lot of times when I help them go back and reflect, they will find that there's more that they've improved on than they thought. And that's encouraging to them always. I encourage them to invest time in things they enjoy when they can. So like friends, family, church, social clubs, volunteering, hobbies, favorite TV shows, and making time for those things. And now when you're a parent, I know, parents, a lot of times they'll say, I don't have time for that. But I always help them break down their schedule and try to find, is there anywhere that we can maximize time? So we can't make more time during the day, right? We only have 24 hours, but sometimes we can maximize time slots that we have without realizing it. So maybe, they go to work and they have a lunch break. Maybe during their lunch break, they can get outside and just go on a walk or read a book, or, they're really, they have that boundary that they're really going to take that lunch break as a time to do something they enjoy. Maybe they have a commute. Like I have a commute to work. It's like 30 minutes now. But during that time, I usually try to listen to, a podcast that I enjoy, a book I enjoy, music I haven't got, had time to listen to, or things like, or maybe I call a friend I haven't got to talk to in a while. And so I really try to, instead of sitting in silence, or sometimes I need that too, but I really try to maximize that time and do things that I enjoy that I'm not going to have time to do the rest of the day. But I already have that built-in time to and from work that I can use and use. So when we talk about self-care, a lot of times people are turned off because like, I don't have time for that. But sometimes if you look at and help parents look and caregivers look at their schedule, there may be times they can't increase time, but they can maximize time that they can use for things that they enjoy. Maybe they're in the pickup line and they can read a book while they're waiting to pick up their child. Anything like that. It's getting creative with their self-care time. Um, like I said, encouraging them to celebrate small victories and practicing that self-care is important. And so, I also encourage them, and I have this at the top, some self-care practices on this slide. Finding and talking to a supportive friend or family member. This can, that can lend a listening ear, offer advice or support, and help them see the ways that they are making a difference and kind of encourage them. I encourage them to develop this, support system for them, so that they don't feel as alone or isolated. I encourage them to get respite, and getting a break however they need. So maybe this is an after school program like tutoring or clubs for the children can get involved in and give them a little extra time after school to, have, a break, a couple times a week. Maybe, there's certain family members that can help you. Maybe it's a extracurricular activity they can get the children get involved in, different things like that. And like I said, that's something we can connect them to in the community if we're knowledgeable of those resources that we can connect them to so they get some respite during those times. And I always encourage parents, if someone offers to help, and they are a good individual that can provide a safe environment for the child, never feel bad about saying yes to help, or never feel bad about asking for help when you need it. Engage these systems that can help you for that. I always encourage them, don't take comments personally. Like I said, don't personalize everything. A lot of times, when they're acting out of anger, children, or they're triggered, it's not something personal. It's just something that they are working through. And so recognizing and trying to separate yourself from those things can help you regulate and also not have those feelings of rejection. Practice acceptance, like I said, celebrate small victories, allow space for yourself and your child. So if you're both getting dysregulated or you're both getting escalated in your emotions, maybe taking a time out or a break for both of you all and going in separate rooms until you can come back together and really regulate, relate, and reason, like I talked about. And then, lean on an agency if the child is involved in any agencies or other community support groups that parents can get involved in. And so, these will all help children, parents and caregivers increase their resilience, and be able to combat some of this compassion fatigue and this burnout. And that's really crucial, like I said, because if parents cannot regulate and take care of themselves, then they aren't going to be able to effectively take care of their children. And when we're a professional working with families of children with trauma, we have the unique opportunity that we get to guide them and support them and connect them with these resources and these tools and this knowledge so that we can better support them through this process and provide them just with hope that there is hope for a future for the children and for their family, and that they will be able to overcome those hard times that they're going through. And it helps them develop a supportive environment overall. And so that is all I have. And then these are my references that I used for the presentation. So now I think we have about 10 minutes. And so I just want to kind of open it up if anybody has any questions.
Thank you, Dr. Archie's wonderful presentation. We don't have any questions in the chat, so I am also going to encourage everybody, if you've got a question, to put it in the chat. But I'm thinking about it from a healthcare perspective. We have some nurses and nursing students on. Is there I'm thinking about the 3 R's, right? Like if you get a child in the hospital or in a clinic or office setting and they're acting up and we don't know if they're suffering trauma, right? Like hopefully your presentation will allow us to think about those kinds of things now, that maybe there's some trauma going on and that we don't know about or aren't going to be aware of. But I just feel like the 3 R's, is there an abbreviated version of the 3 R's for when you're seeing a child that you don't know about trauma? But I feel like that's a good tactic, right? For seeing a child that's maybe just misbehaving and you don't know why, or if there's worse situation behind the scenes kind of thing.
Yeah, really, you could use, the 3 R's. I kind of gave a longer example, but really, I think the 3 R's is, when you just regulate, relate, and reason, when you take time. Sometimes those things will take longer. Like I said in that example I gave, they had to kind of sleep on it before they could reason and stuff like that. But some instances are going to be quicker, especially as professionals. If I had a child it was obvious they were escalating, I knew that I needed to, stay regulated, and I would try to help them regulate, and I would try to understand why they were escalating, or if there's something that I did or we talked about that was triggering, and so I'd relate to them, and then I would just reason with them quickly after. And so yeah, I think you could use this in a shorter term depending on the situation, like a short encounter or a longer encounter. That's why I like it, because it's kind of broad in the sense that we can apply this to quick encounters with children or families, or we can apply this over a time. It just depends on really what the situation needs.
That's wonderful. Thank you. We don't really have any questions in the chat, but we've got some fantastic presentations and great review. We do have a question. What is an effective assessment tool that can be used with children to help determine if the child is experiencing trauma responses?
An effective assessment tool that can be used with children to help determine if the child is experiencing trauma responses. I don't know about a certain assessment tool. I mean, there are different assessment tools for to understand as far as different diagnoses that maybe they have. I use assessment tools for oppositional defiant disorder. I have a satisfaction of life scale. So all of those things help us kind of understand if they have a mental illness or diagnoses. I'm not for sure about a effective specific tool that can help us determine if they're experiencing trauma responses, because it's so different depending on each child. You have to understand, you have to kind of peel back the layers with the child, and it's more of a discussion with them, if that makes sense. You really have to discuss and understand what triggered them. And it takes awareness on our part as professionals to pick up on those things, right? And to help them and to create an environment to where they can discuss those things specifically.
Stephanie added about PCL5 is typically used for adults. So I don't know if there's a children version of that.
Yeah, I need to write that down too, because that's a good, I'm gonna look that up and see if they're. But yeah, and in my work, because I'm not sure, but because I did clinical work, a lot of times I would discuss these things, with the family, and we would try to discuss and get to the bottom and kind of peel back those layers through that.
Got it. And then Garrett asks, what would you propose for those with less cognitive capabilities who may not benefit from mindfulness techniques?
Yeah, so I always tried to find mindfulness and grounding techniques that was beneficial, to their developmental stage. So I use that five senses thing, I would walk through, even I would do it as with first graders. Okay. And so sometimes I would have adolescents that were chronologically at an older age, but cognitively and emotionally, they were at a younger age. So I would end up using one of the more pediatric mindfulness and grounding techniques sometimes with my adolescents, because developmentally they were at that age. So I use that a lot, because most children can understand 5 things you can see, and I would kind of present it as a game to a lot of them too. If you're in the car and you're getting stressed, or you can do it anywhere too. So what are 5 things you can see? What are 4 things you can feel? What are 3 things you can hear? 2 things you can smell, or 1 thing you can taste? And if they can't smell or taste something, I just always encourage them to think about what's their favorite smells, or their favorite thing to taste, if they aren't in a place to do that. So yeah, so just sometimes you have to really curate it to what that person needs, at that developmental age. So
Great. We have about 5 minutes left. If anybody has any last questions, while we are waiting for any questions to pop in, I will thank everybody again for coming. We certainly appreciate it. It is the end of National Human Trafficking Awareness Month, so thank you for being with us all through the month. If you were able to attend any or all of our sessions. And just a reminder for social workers and nurses, you will receive a separate evaluation from the one that I will send out to you later today with the link to rewatch. But social workers and nurses will receive a separate evaluation in order to get your CEs. So please be on the lookout for that. Kimberly asked about the presentation being distributed via email. So Dr. Archie and I can talk about that and
Yeah.
we will let you know.
Yeah, I sent that to Kim. I think it was a PDF. I'm
Yep.
fine with you
Is
sending
that
that.
okay?
Yeah, I'm fine
Great.
with you.
So later when I send out the evaluation and the link to rewatch, I will include that PDF in there as well. So we appreciate you all and thank you, everybody. It's been being very interactive today, and so we appreciate that as well. And thank you, Dr. Archie. Great presentation.
Thank you all so much. I appreciate
Okay.
it.
Okay.
I'm muted. Do you need anything else from me, Kim?
No, ma'am. Thank you for everything. Appreciate it very much.
Thank you.
Yeah, I
All
was just
right.
going to
Thank
stop
you all.
I'm going to stop the session now. All right.
Okay. Thanks.
Have a good
Thanks,
day.
Brian.